Let's talk about perineal massage, a simple technique that helps prepare your body for childbirth. So, what is it? It involves gently stretching the area between your vagina and anus from around 35 weeks of pregnancy. It's especially helpful for first-time mums and anyone planning a vaginal birth. It helps make the area more flexible so it stretches more easily during labour. Research shows it can reduce the risk of severe tearing or needing an episiotomy. It might also shorten the second stage of labour, reduce pain and speed up recovery by minimising tearing. This star on my hand represents the anus and the skin here on my hand represents the perineum. Here's how to do it. Start when you're relaxed, perhaps after a warm bath. Make sure your hands are clean and your nails are short. Find a comfortable position and use a lubricant such as vitamin E or a food-grade oil, such as almond oil. Place your thumb about 2.5 to 4 centimetres inside your vagina and then gently press down towards your anus and out to the sides until you feel a stretch. Hold for 1 minute, breathing deeply to relax. Next, gently massage the lower wall of the vagina in a U-shaped motion for 2 to 3 minutes. Try to do this daily or as often as you can. If it's tricky to do yourself, you may want to ask your partner for help. For more advice, speak to your midwife or visit the RCOG website for helpful diagrams and further information on reducing perineal tearing.